Assalamualaikum. My name is Alim. So today, my friend Aisha and I will present the result of our research related to plastic surgery. So, what is plastic surgery? Plastic surgery is medical specialty that focuses on enhancing a person's appearance as well as reconstructing face and body tissue deformities caused by sickness, accident, or congenital anomalies. Plastic surgery improves and restores both function and aesthetics. There are two types of plastic surgery. The first one is reconstructive plastic surgery and the second one is cosmetic plastic surgery. What is reconstructive plastic surgery? These restorative treatments are often performed on kids born with a cleft top lip. Warriors injured in combat also benefit from these procedures. Another example is burn sufferers undergoing reconstructive surgery. While cosmetic surgery is used to improve one's overall appearance by altering and changing normal anatomy to make it more pleasing to the eye. Unlike reconstructive surgery, it is not medically necessary for cosmetic surgery. Cosmetic surgery operation includes breast augmentation, breast lift, liposuction, abdominoplasty or known as tummy tuck, and facelift. It is true that plastic surgery improves one's confidence in terms of their appearance. The use of plastic surgery to alter our look is becoming more popular these days. These procedures, however, do not come without risk. One of the risks that will be mentioned here is the risk of infection after getting the surgery. There are low risk and high risk infection in plastic surgery. Most infections are caused by skin organisms and occur in the early post-operative period. Infections can also develop years later. One of the infections is cellulitis. Cellulitis is a type of skin infection that can develop after surgery. Internal infection can be serious and require intravenous or IV antibiotics in some circumstances. Plastic surgery also affects people in a way that they think they are not perfect enough and they are not comfortable living in their own body. For example, nowadays, many influencers or Instagram celebrities do plastic surgery. They influence their audience to do plastic surgery by portraying their perfect body image. This usually leads to insecurities in people and them wanting to do plastic surgeries. Body image is a common source of insecurity. Many people are self-conscious about their appearance and wonder if they meet an imposed standard. There is no required link between body insecurity and physical health or attractiveness. This form of insecurity can affect people of all shapes and size. There are also some cases where once people go through plastic surgery, they will keep on doing plastic surgery and this leads to a change of addiction of doing plastic surgery. One is addicted to plastic surgery if they are always pointing out faults and flaws in their appearance. This has a significant impact on patients' mental health since they may worsen or acquire body dysmorphic disorder or known as BDD. BDD sufferers feel that by undergoing several cosmetic procedures, they will be cured of their condition. However, this is not the case. For this type of significant illness, surgery is not the best option. Those who become hooked to the cosmetic surgery and continue to procedure done on them might face serious risk. The fact that it might permanently destroy an individual's muscles and skin is one of the most common hazards. Based on all these problems, the purpose of research was to explain the risks and causes of performing plastic surgery on oneself. This research was carried out as a precautionary measure and to increase the public's knowledge of the risk of plastic surgery before performing it. There are three research objectives. The first one is to investigate the practice of plastic surgery done in America and Korea. Number 2, to identify the pros and cons of plastic surgery in Islamic law perspective. Number 3, to determine the pros and cons of plastic surgery from a medication perspective. There are also three research questions. The first one is, what is the practices of plastic surgery in America and Korea? Number 2, what is the Islamic perspective towards plastic surgery? Number 3, What is the medication perspective on plastic surgery? This research was conducted to provide adequate information on individuals and society before performing plastic surgery. It aims to spread awareness and act as precautions for people and society who are interested in plastic surgery or possible negative upbringings from it. For individuals, this study aims to help them make decisions and understand the impressions that will be faced before undergoing plastic surgery. In addition, this study also provides them with the information about the procedures that need to be followed to perform plastic surgery. One also needs to understand that there are two types of plastic surgery. The first one is reconstructive surgery and the other one is cosmetic plastic surgery.
My name is Aisha Shazlin binti Shahimi. My metric number is 1200122. I will be presenting the discussion of our research paper. First discussion of our research paper is plastic surgery practices in United States of America and Korea. According to an article by Forbes, authored by Rebecca Ruiz on November 2006, facelift, chemical peels, butt implants, and other surgical and non-invasive cosmetic procedures cost Americans $11.5 billion in 2006. According to the International Society of Aesthetic Plastic Surgeons, or known as ISAPS, the United States has the greatest total number of plastic surgery treatments in the world. According to the most current survey, 4.2 million plastic surgery procedures were conducted in 2016. According to the American Society of Plastic Surgeons, ASPS, this accounts for 17.9% of all plastic procedures performed around the world. In 2018, about 80 million people in the United States got surgical and minimally invasive cosmetic procedures. This indicates that over 250,000 more procedures were performed in 2018 than in 2017. Over the last 5 years, cosmetic surgical procedures have become more popular in the United States, as reported in Medical News Today. These statistics clearly show that United States has a high rate of plastic surgery from year to year. While in Korea, the advancements in medical technology and the rapid rise of web-based mass media and social media, public access to cosmetic operations has considerably grown. In particular, in South Korea, a rising number of people are receiving cosmetic surgery. According to the article by Korea Expos reported by Ho Kyung-jung on 10th January 2018, Korea ranks first on a per capita basis. According to the International Society of Aesthetic Plastic Surgery, ISAPS, with 13.5% cosmetic treatments completed per 1,000 people. However, because ISAPS research only covers aesthetic plastic surgeons from around the world, the real number of cosmetic treatments performed may be larger if data include procedures performed by general practitioners. Furthermore, given that no official statistics are available in Korea and that cosmetic operations are not covered by the Korean health insurance system, we might assume that this number is significantly higher. The market for plastic surgery in South Korea is enormous. The Washington Post and the New Yorker have both reported on the popularity of plastic surgery in South Korea, where the International Society of Aesthetic Plastic Surgeons estimates that 20% of women have received some sort of cosmetic surgery. Plastic surgery tourists brought in $107 million in 2014. As the market grew, so did the number of new enterprises. In September 2017, the National Tax Service reported that there were 1,414 plastic surgery clinics registered in South Korea. This figure excludes the number of large hospitals, dermatological clinics, and dentist clinics in Korea that provide a variety of other aesthetic procedures. Next discussion is about the Islamic perspective towards plastic surgery. Humans are as good as the creation of God. Everything that is created by God has its balance and perfection, and that must not be overlooked. Plastic surgery is considered haram in Islam and is only permitted for medical reasons such as deformity. According to Muslim scholars today, plastic surgery is allowed when there is a genuine need for it. This rules is based on an incident in which the Prophet, peace be upon him, allowed a companion named Arfajah ibn Sa'ad to wear a gold nose after his nose was cut in a battle. In addition, such processes are not intended to alter God's creation. The primary incentive for approving such procedures is to avoid damage and relieve the patient's physical and mental pain. Plastic surgery is becoming increasingly popular in Muslim countries. Is it a frivolous indulgence, or does it meet a genuine bodily and psychological need? Plastic surgery is divided into two groups by well-informed scholars. The first one is plastic surgery is needed to correct any damage in the body that is unable to function properly. This type of plastic surgery is known as reconstructive plastic surgery, which is performed to repair congenital or acquired abnormalities. This plastic surgery is permitted because the main intention of it is not to alter God's creation, but to improve the function of one's body. The goal of surgery for congenital abnormalities is to restore function while also restoring normal appearance and relieving psychological strain or humiliation. The second group of plastic surgery is a surgery that was carried out in order to improve one's appearance, or in other words, is surgery for beautification. It is widely known as cosmetic surgery. Such surgery is unneeded. It is considered haram and not allowed in Islam. Men and women who are more concerned with beauty than their health do not care about religious prohibitions by undergoing plastic surgery to enhance their beauty will find that they put themselves through misery, pain, and financial waste because they unnecessarily alter what God has made. And the last discussion for our research paper is the medication perspective on plastic surgery. According to the Healthline article, there are lots of complications caused by plastic surgery. One of them is hematoma. A hematoma is a blood pocket that looks like a huge painful bruise. It happens in 1% of breast augmentation surgeries. It is also the most prevalent problem following a facelift, affecting about 1% of patients. Males are more likely to develop this than females. Nearly all procedures have the risk of hematoma. If the blood collection is substantial or expanding rapidly, more surgeries to drain the blood may be required. Although plastic surgery has adverse effects and risk to the patient, it also has some benefits according to the medication perspective. In a recent study conducted by the University of California, 98% of individuals who underwent plastic surgery reported a considerable rise in their self-esteem and sense of self-worth. Plastic surgery treatment performed by patients can reduce self-consciousness and alleviate social anxiety. This will make a person more friendly, less vulnerable, and better at socializing. They will also stand out more and show their new selves without having to feel insecure. From the findings and the facts given, we can conclude that most people do plastic surgery to enhance their self-confidence and improve their quality of life. Plastic surgery restores and improves function as well as appearance. There is no right or wrong in performing plastic surgery. It is a person's own choice that they themselves will and are willing to accept any risk in performing them. Some people claim that by undergoing plastic surgery, they can improve their lives and they become more confident in carrying out their daily lives. But there are also those who regret having unrealistic expectations about how plastic surgery can change their lives. Plastic surgery is done for the good of oneself and not others. Performing plastic surgery does not necessarily make other people more affectionate and like to hang out with that person, but is done to please oneself and improve oneself. As for the Islamic perspective, plastic surgery is permitted in Islam for the treatment of disease to save or retain the function of body organs. Cosmetic surgery will only be permitted in Islam if it is required due to a medical condition or a physical deformity. Thank you.